Good morning, YouTube. It's Victoria. How are you this kind of chilly, dark day? If you're new here, again, I'm Victoria. I make videos about just about everything. How to pack your bag, how to do your makeup. Right now, this is the 5th installment for my Psych Series, and today we're going to be discussing PTSD, which is, I don't want to say my favorite, but it is my favorite. It's what I'm certified in trauma. So if you want to keep watching it, I mean, obviously, just keep watching it. We're just going to go right into it. Okay, so PTSD, post-traumatic stress disorder. Okay, like the title is, or of what this disorder is, it's post-traumatic. So usually what happens is after a traumatic experience. Okay, and this is also to witnessing, not having trauma experienced towards you, but witnessing, let's say, abuse happen. Okay, witnessing a car accident, a famous one, us veterans, us soldiers going overseas and experiencing some crazy ass shit that we just can't shake off. Okay, so with that being said, there are several symptoms for PTSD. Usually it's about 17, but it's manifesting more and more as per the National PTSD Center. But there are four main clusters, four main criteria of PTSD. Okay, and so the four main are the re-experiencing. So these are nightmares, the flashbacks, anything that kind of reminds you of that traumatic experience or experiences. Okay, you're gonna end up thinking, and sometimes it's very vivid about how you are reminded. Okay, these flashbacks. Okay, sometimes you can feel disconnected or dissociate. Okay, as to, it's kind of like a disconnect. It's a stress response from the brain, so that way you don't respond as if it's the same. So it's kind of like the space out moment, and you're like, oh, how'd I get here already? Dissociation. Okay, so first one is re-experiencing. The second one is avoidance. Okay, so avoiding person, places, or things that remind you of this trauma. Okay. Third are negative cognitions and mood. So a lot of it is, let's give the combat veteran. A majority of them will feel guilt or survivor's guilt. Why did I have to live versus this other person we tried to save? Okay, and the mood. Okay, you're going to find that a lot of people that suffer from PTSD will be very extreme with their anger, sometimes rageful, very irritated, sometimes real sad and mopey. It's like, almost like a culmination of the symptoms of depression, anxiety, mixed into one bipolar, but this is its own separate breed. And arousal or hyperarousal. Okay, and so whenever it comes to this, we end up avoiding thinking about the trauma. Okay, avoid thinking and just basically avoiding, period. Like, you want to live in a bubble and not have to be around, oh, we drove down here, this is where my car accident was, yeah, we're going to take the long way home. Okay, that's basically what that is. Okay, you're going to have flashbacks. Again, these are these intrusive memories, okay, that can hit you at any time. Number one trigger to a lot of memory is smell. So if you smell a type of cologne or a perfume, if you smell gunpowder, gunshot residue, or that kind of smell after a weapon is discharged, that can bring up a memory. Okay, an unwanted intrusive memory. Okay, loss of interest in in things that you used to like to do. It's called anhedonia. Okay, also lack of motivation. You just don't have that drive anymore to do anything, to go on with your day. Feeling guilt or shame. Again, why not me? Shoulda, woulda, coulda. That type of mindset. So there's a lot of guilt. self-medication or self-medicating with substances. All right, and so it becomes this vicious cycle where, oh, okay, well, I'm reliving that or reliving this. Let's pound a few beers or let's do some drugs. So that way you don't feel at that moment. But what happens once you become sober? It's all there for you. And depending on what you did, okay, can make the matter worse. And then it becomes this vicious cycle, okay? Sleep difficulty, majority of the time, patients will have insomnia, or these nightmares, these vivid nightmares. And of course, depending on how stressful their day was, okay, stressful as in like negatively stressful, ginormous, catastrophizing, blown out of proportion, okay, will dictate how not only vivid, but how intense the nightmares are, okay. Aggressive behaviors, again, because of the moodiness, because of the, what was experienced, because of how crappy they feel and they think, okay, there's going to be some aggressive behavior, okay. Maybe the yelling, the intensity and anger, it's almost rageful. I'm talking breaking things, but also too, partaking in risk-taking behavior, driving under the influence, okay. Promiscuity and just not caring who they sleep with, okay. Gambling, those types of things, risk-taking behaviors too, okay. The inability to concentrate, because what is your ability to concentrate if your desk in your mind is covered with all these bad memories and you just need that little bit to do an assignment, to make it to your appointment? Probably very, very hard, okay. And especially too, if they're in that phase of reliving, the ability to get them, it's almost like panic, the ability to get them out of that mindset, especially when they're in that moment, is going to be rather difficult, okay. Easily frightened, or that hyperarousal state, okay. So like with me, for example, I still have a problem with fireworks, okay. So the booming sound, if I know where it's coming from, I've gotten better over the years, but I need to ground. I need to make sure, like, okay, I'm here at Disney World and my family's with me, my kids are holding my hands, and I'm okay. But is that always usually the case? No, especially after you start experiencing these PTSD symptoms, right? And so whenever you hear a booming sound, door slamming, again, a certain song that was playing when something happened, okay, that can trigger that startle response in people. Okay, so those are just a few symptoms of PTSD. And again, that can be expressed in a number of different ways, but it's usually pretty much the same. Okay, so there are 3 different types of assessment/tests that are given. Okay, so the first one is the PCP PTSD. Okay, so the PCP, primary care checklist, or primary care physician, okay, can ask you about 4 questions. Have you experienced a trauma? Basically it's kind of lighting up, or kind of giving us that red flag, ding, ding, ding. Okay, we suspect that this is happening. Okay, it's about 4 or 5 questions. Okay, it's since been updated to incorporate DSM-5 criteria or DSM-5 standards. Okay, the second is the PCL. Okay, PCL-5. Okay, and is the PTSD checklist. Okay, this encompasses all 5 criteria of PTSD. Okay, and these 20 questions are specific, to the symptoms that we're experiencing. Again, each of the stages and everything, but it kind of gives you like that definitive, yes, you do have PTSD. Okay, normal. I don't want to say normal because I hate that N word, but the start score, I guess, would be like between 31 to 35, but it still doesn't discredit that, oh, well, you have the intrusive thought and memory, and then the avoidance, which would be your flags there to kind of diagnose them anyways with PTSD. Okay, the gold standard is the CAPS-5. Okay, and that is to kind of gauge how severe the PTSD is. Okay, so whether it's the PCL-5 or the CAPS-5, okay, person has it. Now what do you do? Okay, there are a whole slew of different therapies out there that help with, help these individuals to get through PTSD. A lot of them, you'll find that you will have to integrate other therapies into this to help people. Okay, so not only do we have to go around the realm of change the way you think and feel, therefore changing the behavior, we also have to delve into some DBT, okay, some dialectical behavioral therapy, okay, kind of emotion regulation, changing the way that you interact with interpersonal relationships, distress tolerance, okay, because let's say a common problematic pattern of thinking is the overgeneralization. All of this is either good or all of this is either bad. These people are going to view themselves as all bad. Okay, any type of mistake, they're going to be very heightened with any mistake that they did because that would remind them of whatever trauma that was. See, this is why this happened, because I wasn't on my game. And so they're going to be very hard on themselves. Okay. So that's why we need to encompass the DBT. A lot of it is spirituality as well, not making right with God. Okay. So if they are willing, okay, but a lot of the time too, you can take the most religious person and they will lose their view and sense of religion, their spirituality and faith. Doesn't matter if they're born and raised Catholic, Protestant, Baptist, doesn't matter. Okay. I'm not saying once it's gone, but they need to make right with the thoughts and, kind of get back into what comforted them to begin with religion. Okay. A lot of it is also too incorporating activities, whether it's exercise, taking up some hobbies. A lot of patients like doing diamond paintings, puzzles, playing cards, dominoes. Okay. And you'll notice too, especially in the military population, that they would like to feel that sense or experience that sense of camaraderie again, because they feel that others will not understand. Okay, it's that misunderstanding thought that triggers a lot of this. You don't know what I've been through. You don't know what you're talking about. I'm just going to deal with it myself. Okay, so a common one that I use for therapy as well is cognitive processing therapy, which encompasses about 4 or 5 different theories, different modalities. Okay, on top of the activities, the reintegration, and everything else too. Okay. It's what I use. I find it as one of my standards or one of my ways of doing it as well. But then I also dabble in, depending on the type of trauma, I'll also put in or incorporate, it's called ET or PET. It's the exposure therapy. Okay. So this you have to do very carefully, because it may, all that work that you guys have done therapeutically together, maybe thrown out the window. So it needs to be methodically planned out. Okay. But aside from that too, you need to make sure that the therapist that you are paired with, okay, you trust, because a lot of this is going to be some sensitive information. And if you cannot trust this individual and you feel like you have to lie or withhold information, how are you supposed to get the help that you need if you're only opening the dam, I guess, a quarter of the way full? Open. You know what I meant. It's early. Don't judge me. Okay. Along with the type of therapy as well, there's also partial residential or inpatient. Okay. It doesn't mean that you're going to be locked in a bed or wackadoo or anything like that. That just means that it's almost like it's in a hospital setting. It's more controlled. Okay, but there is a structured day from when you start until the end of the day. There is homework and such like that too. And yes, I give homework, especially with CPT. Medication will usually be administered, but again, I mean, it's up to you and your clinician, but it does help take the edge off. So that way you are able to focus and you're able to concentrate on yourself and getting better. Okay. Does that mean that, again, it's a lifelong thing? Possibly. But would it be worth it so that way you don't continue to re-experience? I think so. Okay, so a lot of medications out there, SSRIs, so you have Celexa, Lexapro, Zoloft, Prozacs. You have also your SNRIs, Effexor, Cymbalta. Each of them kind of geared towards trying to help with the mood, the depressive mood, but then also the anxiety portion. Okay, a lot of the time too, it's that hyper alertness. Okay, so welcome to the enlarged amygdala because of this trauma. Okay, and that's what you're going to see as one of the anomalies, or not anomalies, but differentiating brain structure. Okay, is that the amygdala now holds these memories, these traumatic memories, and it is enlarged because now it's overactive. Think fight or flight. There you go. So, is there a right or wrong way, or is there a time frame to get better? No. Okay, because depending on the trauma, depending on people's upbringing, believe it or not, like their temperament, okay, their ability to work through problems and to work through them, not just push them to the side, definitely dictates how, I don't want to say dictates, but it influences the ability for the person to recover from this trauma and to improve, okay? So that also depends as well. There may be a chronicity, but again, so what? Okay, we're so focused on the title or the negative stigma here. A lot of us don't want to go and get that help when it's much needed. But all right, that's my little ditty about PTSD. And if you have any questions, comments, or concerns, post them down below. But remember to subscribe and click on that little bell so that way you're notified of any new videos. Okay, and stay tuned. The next video is going to be an interesting one. Okay, I hope you guys, if I don't get this video out or another video out before the holidays, Merry Christmas and a Happy New Year, but I'm sure it'll be out there before then. Okay, be safe. Okay, bye.